Dr. Curtis Cornish, and I have been teaching medical students at the University of Nebraska for 25 years. Historically, animal laboratories were the backbone of physiology classes, especially in medical schools. For many reasons, very few schools have them anymore. This is unfortunate because it distances the students from physiology as an active science and moves it into an area of textbook learning. As we transitioned away from having live animal labs, we were fortunate enough to have a grant that involved the long-term studies of conscious dogs. This allowed us to use these animals in demonstrations for the medical students. After we had accumulated a number of these files from the demonstration, it was no longer necessary for us to have the animals involved. Then, with changes in technology, we found it necessary to redo the lab and fill in some gaps. Because of a generous teaching grant from the Hirschmans here in Omaha, we were able to obtain additional animals to do this. In 2009, we published this dog lab on MedEd Portal. Unfortunately, it has received little notice. This has been discouraging because when I have discussed the lab with other educators at various meetings, they were interested in it, but not aware of it. The purpose of this YouTube video is to let others know of its existence, what it contains, and how to obtain a copy of the CD. The lab is intended to show students actual cardiovascular recordings from a conscious dog and give them a feel for how the entire system responds to various interventions. This is a list of those interventions, and I will actually be going through as I give a very brief overview of the lab. It should be noted that the animals were conscious and trained to lie quietly on a table. The CD also has a student handout that, as you can see, has questions that the students should be thinking about as they go through the lab. It also has a page for instructors to help them understand how to best utilize the disc. At this time, I would like to do a brief walkthrough of the lab and give you an idea of some of the things that are actually contained in it. Entry page, brief instructions. This is the link to AD Instruments and shows you how and where to download Lab Chart 7, either for Windows or for Mac. The people at AD Instruments were very gracious to produce this free program that allowed this presentation. There's a page that shows how to use the lab chart reader. I won't go through that at this time. If you obtain the CD from us, it will also have a small group assignment, and the students can do this either in class or they can download the appropriate files and they can do it out of class. So we enter the lab, some suggested learning objectives. There are brief videos showing the beating heart, fibrillating heart in two different situations. So here you can see the beating heart. We fibrillate the atria, and we also fibrillate the ventricles to give you an idea, or give the students an idea of what that's like. We also include a description of the instrumentation so they have some feel for a catheter being placed in the left ventricle and the other places. We walk through the events of the cardiac cycle, so you can go ahead and open this file. It then allows you to identify some beats. By hitting shift and left click, you can then identify aortic pressure, ventricular pressure, and left atrial pressure, and then overlay those to show how they actually do correspond in the cardiac cycle. We show the effect of changing venous return by occluding the inferior vena cava, the effect of increasing total peripheral resistance by occluding the descending thoracic aorta, or by injecting phenylephrine, and you can see the differences in those. We also show the effect of injecting isoproterenol, and again you can overlay those files so there's left ventricular, or overlay those tracings. So that's left ventricular pressure, and this then is aortic pressure. And you'll see that ventricular pressure is increasing, aortic pressure is going down, which is a condition known as idiopathic hypertrophic subaortic stenosis. And amazingly, we have found this consistently in all of the dogs we've looked at. We look at nitroglycerin injection. We look at the effect of increasing heart rate, coronary occlusion, and we can see the effects of a 5-second, a 10-second, a 15-second occlusion. We have extrasystole, where we have electrodes on the ventricle and give premature beats and look at the effect on stroke volume. We inject veratridine into the left coronary artery, left circumflex, and see the very dramatic effects that we get from that. Hopefully this will be useful for you. If you're interested in obtaining a copy of this CD, you can contact myself at this email address, Dr. Zucker at this email address, or go to MedEd Portal as indicated here. If you go to MedEd Portal, they'll require you to register, but that's just so they can determine how and who are using the programs that they have. I hope that this will help the students understand that the intact animal is far more interesting and in many ways far more challenging than what they obtain from textbooks. Again, Dr. Cornish, and I'm grateful for the opportunity of providing this for you. Thank you.